Hello my friends, this is James Elam running to represent you in the House in District 36. So this is another hard thing for me to talk about now. We have 27 inmates and 8 staff members that are positive at Huttonsville Correctional Center. That's according to DMAPS. I'm just going to get right into it, folks. I'm the only one running for the House of Delegates that I know of who used to be a corrections officer. I've been warning about this, that we need to start wearing masks. It was the whole point that I wrote the article that I wrote in the Gazette yesterday. We all need to do our part to slow the spread of this virus. The mask, what it does is it prevents droplets if you are asymptomatic or have the virus. If you have it, you know you have it, so you should be quarantining. And if you're asymptomatic, you have no idea that you have it, so you don't know that you're spreading it. That's why we wear a mask. It reduces the spread because people can't spread it as easily when they're wearing a mask. That's only so effective if everyone wears a mask. I'm really struggling behind this now because now there's 27 inmates and 8 staff members. And I know a lot of people could just care less about that. But seeing as how I used to be a corrections officer in a state prison, this is personal for me. I used to watch our state's incarcerated inmates, and I get stuff all the time about it that I don't care about criminal justice reform when I do. This is the exact reason, because I know how bad this is going to get if we don't do it right. We tested everybody at Huttonsville, but we need to test everybody else. We need to test every regional jail, every juvenile detention facility, and we need to test every state prison. All the inmates, all the staff, all the officers. We need to do it. And us as the public, we need to go through with our commitment to wear a mask to prevent the spread of the virus. Every other country seems to have understood the value behind it. I don't know why we can't as Americans. I don't know why we can't put some of our own personal feelings aside for the greater good. I don't know why we can't do that. But now we have a situation in our jails and prisons. I'm telling you now, it's May 23rd, it's 4 o'clock in the morning, and I'm just now finding this out. This story was posted 9 hours ago when I was asleep. Now I'm awake, and I'm finding all this out. And who cares? Honestly, does anybody really care at this point? I do. I know other people do, but I don't know what we're doing. I don't know what we're doing. Not just in West Virginia. I don't know what we're doing as a country. I look at Japan. 126 million people. Out of 126 million people, 784 died. Want to find out how many have died in the United States? Let's find out. Okay, the United States has 1.6 million cases, about 96.3 thousand deaths, and 313,000 have recovered, but that doesn't change anything because it still leaves 1.3 million active infections in the United States that are either going to go one way or the other. You're either going to die or you're going to recover. And I know there's people saying, well, we need to build up herd immunity and do it. No, that could be further from the truth. What family member are you willing to sacrifice in the name of hoping that in the greater grand scheme of things, we get herd immunity? Who are you willing to sacrifice for that? I'm not sacrificing my mom or dad or anyone in my family. That's the problem. That was what my article was trying to highlight. The whole entire problem is a lot of people aren't going to care until something happens to them. That's the reason there's almost 100,000 deaths in the United States and 1.6 million people actively infected or confirmed infected with 1.3 million active infections. You've either recovered or you've not recovered. That's how this virus goes. There's not a cure. There's not a flu shot like we get for seasonal influenza. In the last 24 hours, 26,907 confirmed cases throughout the United States. What are we doing? Guys, back to the jails and prisons. I'm just telling you, if we're going to test every other facility, and I almost am confident there's going to be way more cases than we even want to know about. And it starts because we don't for some reason, a large portion of us don't seem to want to look at science. And it's making me a very unpopular candidate right now. As many as of you know, I'm running in the 36th district, and there's a lot of people that do. Somehow this is controversial. Sometimes this issue became controversial. And now we're fighting over should we wear one or should we not. We're arguing. We're literally arguing just facts. We're taking facts and laying them aside as if they're not facts when these are facts. These are just downright, no matter what you try and do, this is just fact. That if you wear a mask, there is a less likely chance, or virtually almost no chance, that you're going to be producing droplets into the air when you speak or talk or not obeying social distancing. And if you're asymptomatic, a lot of people get infected because someone in their household or maybe someone they know who didn't feel sick or a coworker comes to work, no one's wearing a mask, they don't feel sick or they haven't displayed symptoms yet. The next thing you know, everybody's sick. And another thing that I think, I'm not trying to toot my own horn here or anything, but I'm starting my classes on an undergrad and a bachelor's for community and public health. I've been studying this disease since it came to the United States and its symptoms and how many people that it infects. I've been looking at the data almost every single day because I'm scared for myself and for other people. And, you know, there's just so much misinformation that's going around that, you know, oh, if you're over 65 and you have pre-existing conditions, stay home. We know that this doesn't just infect people who are older or who have pre-existing conditions. There's some people who are perfectly healthy and have died as a result of this. So we're not doing ourselves any justice by ignoring public health recommendations. And I'm just as concerned about the economy as everybody else is, because if this spikes or we get more outbreaks, we are going to pull back and we're likely going to shut down. And if you think we lost small business in this country on the first time we had to shut everything down, I guarantee you if we can't do it on our own just because it's the right thing to do, and we don't find that enough people are doing what they need to do, I can almost guarantee, it's just like writing on the wall to me, that the economy will probably pull back and shut down again. People will be out of work again. How do we continue to pay people on unemployment when we've seen record high numbers of unemployment since the Great Depression? I just don't know. I don't know how we're going to do that. So, you know, and on above everything else, all that aside, as difficult as that might be, I don't want to imagine that this death toll gets any higher. I don't see any excuse anymore as to why a country the size of Japan, with 126 million people, I don't see how they only had 784 deaths. And we've got really smart people here in the United States, 330 million plus people, and we've had close to 100,000 deaths, and more deaths are surely on the way, I can assure you of that. So I don't know what we're doing. Now we have jails and prisons. It breaks my heart. Personal to me. I became a corrections officer because I wanted to help people. What are we doing now? What are we doing now to help these people? A lot of people are in jail and prison because they suffer with addiction. Totally not fair. I've talked about it for years now, since I started that job in 2016 all the way through 2017. I talked about how addiction and people who have non-violent, low-level drug offenses and whatnot, how those people needed to be in rehabilitative care. The correctional setting is not doing anything for those people. So, again, a lot of problems when it comes to criminal justice to begin with. This is a huge problem. And again, I just want to get this number right here too. This is from WDTV. 27 inmates, 8 staff members at Huttonsville Correctional Center test positive for COVID-19. DMAPS officials say the enhanced testing and ongoing contact tracing have established connections among several of the positive employees and between that group and the initial inmate to test positive. So I'm telling you, this is one facility with 27 inmates testing positive. If you don't think 27 inmates isn't going to turn into an entire facility at some point, you are wholeheartedly wrong. With how close quarters those facilities are, and on a housing unit, I was a housing unit officer, how close that contact is on a housing unit, You're out of your mind if you don't think this is already spreading. What happens today, we won't probably see the effects of for about 2 weeks because of the incubation period. So we got to get on top of it. And I'm telling you, I'm going to keep warning you guys about what we need to do, or what I think we should be doing as a society. It's up to us to listen. I mean, and it's 4 in the morning. It's 4 in the morning. I get up, I look at these things, and it's 4 in the morning. And like many other West Virginians, I get up super early in the morning. We just start looking at what's going on. And every day, as each day goes on, I get less and less confident in what we're doing. Not even just in West Virginia. That's not even the case. I think it's on a national scale. The incompetence has been just appalling. Absolutely appalling.